Good evening and thanks so much for choosing KLBK News. I'm Terry Furman.
I'm Matt Stell. Hard to believe that 5 years ago this week, Lubbock saw its very first case of the COVID-19, and what would transpire over the next 2 years is something that none of us will never forget.
KLBK's Maddie Powers talked with some experts today who were charged with getting us through the pandemic. And Maddie, even they say it was something they had never seen before.
Yeah, Terry, they both agree that they were walking into unknown territory. The coronavirus was something new with little information about it, and experts were forced to adapt daily as new data was found.
Under Governor Abbott's latest executive orders, growing concerns over the coronavirus have led to cancellation.
As we continue to learn more about this novel coronavirus.
I mean, I'll be frank, I wrote letters to all my kids because I didn't know what was going to come out the end of it.
I mean, I remember it was spring break, and they decided to not bring kids back from spring break. So it was that immediate trying to figure out how to do virtual school.
It was a time of uncertainty for all of us.
The coronavirus, it's uncharted territory for us all.
It's now been 5 years ago this week since Lubbock had its first case of COVID-19, and Mayor Dan Pope eventually declaring a disaster due to the pandemic.
Cover your face. I think that message is as simple as it can be. Wear your mask.
Hospitals were testing as many as 300 to 400 people for COVID a day, and over 1,000 people in Lubbock County died from the virus.
We did not know how COVID was transmitted. We didn't know how contagious it was. We didn't know how ill it could possibly make people. We really knew nothing. I mean, this was a new novel virus that we were responding to. And I think it was that those unknowns were so much scarier, because we didn't know how to plan. We didn't know how long it was going to last.
It was a desperate time, and a lot of heroes, healthcare providers, staff, everybody, the whole community. I mean, Lubbock response was amazing, I gotta say.
But now, 5 years later, things are back to normal, with COVID becoming more like a common cold.
It's evolved from something that was extremely deadly to now something that, could be a bad cough, cold, or flu. Certainly, it still has a propensity to find. I've always been amazed about COVID and its ability to kind of seek out the weakest portion, whatever affliction that person had, and still, even the people we see today are at risk because of their comorbid conditions.
One thing that surely helped in the fight against COVID was the vaccine, which became easily available for most folks in the spring of 2021. Now, Dr. Hendershaw emphasizes that even though it's been 5 years, it's always good to be mindful to prevent any sort of spread by covering coughs and washing hands.
Yes, indeed, Maddie, thank you.